It's Care Providers of Minnesota's The Inside Scoop with your advocacy team, Toby Pearson, Nicole Matson, Todd Bergstrom, and Patty Cullen. This week's host, Nicole Matson.
Hey everybody, it's Nicole Matson from Care Providers of Minnesota. I am your newest member of the advocacy team. Today, the rest of your wonderful advocacy team is at the Blue Ribbon Commission. So they left Inside Scoop up to me. Not sure if that's a good idea, but here I am. So what's been happening at the Capitol this week? There were several things heard in the House that pertain to our profession. There was a bill on medical education research cost to be able to allow that funding in nursing homes. There was a grant, energy efficiency grant program that's part of a larger package, but there was an energy efficiency grant for nursing homes that was also heard in the House. And then consumer directed community supports, which was referred to HHS policy. And then elderly waiver. Representative Schultz put forth the elderly waiver bill, which the long-term care imperative spoke to. So Toby Pearson spoke on your behalf. We know that elderly waiver is vitally important to keeping and serving seniors in the community or the place that they choose to call home, and that it saves the state money because it could potentially keep people out of a nursing home bed, but that is sorely underfunded. It's DHS estimates were between 10 to 50% underfunded below cost. So they spoke as well. DHS was there as well. So we hope to continue that conversation and that we get some action to further fund elderly waiver. And there was guardianship conservatorship, the modernization of guardianship and conservatorship, which was heard in judiciary in both the House and the Senate. There was a provision that we didn't like that was in that bill, and they removed it, and it looks like it's going forward. And then the big thing was COVID-19, which I'm sure is a big thing in your world right now. There were hearings in both the House and the Senate. Commissioner Malcolm spoke along with the Minnesota Hospital Association President, Dr. Karani, about plans that are in place to help prevent spread and what we're going to do if it comes to Minnesota or when it comes to Minnesota. So I'm sure there will be more heard as far as funding and other allocations of resources in the coming weeks. And that's about it. If you haven't signed up for Day at the Capitol, it's March 18th, and you really should do that. You should do that now because that's your way to connect with legislators, let them know your stories and what it is that you do and how vitally important you are to the communities that you serve. And I expect to see you there, so you better sign up. Thanks, everybody. Have a good weekend.